Hello everyone, welcome to the information session regarding the pharmacy technician program. My name is Fabiola Takla and I am the program coordinator for the pharmacy technician program, and I have my email here to share with you in case you have any questions to ask me or to email me at the end of the session. The goal of this information session is mainly to give you some idea of how the program is run, some more details about our labs and placement. So this way you can make a sound decision if this program fits your needs and goals. At the same time, I will be taking you in a virtual tour through our labs, um, so you have an idea what quality of work you will be doing. The pharmacy technician program is a 2 year program, and it prepares the graduates to become registered and find jobs in different sectors of the field: community pharmacists, hospital pharmacists, long-term care facilities, insurance companies, and computer software companies as well. So the question why the pharmacy technician at Centennial College, and the reason is our curriculum is current and up to date. Our college has #1 reputation and our employers love to hire our students. We have full-time faculty that are all current and working in the field, as well as all registered. The program would find you placement 4 weeks in a community setting and 4 weeks in a hospital setting. And we have been accredited for 5 years, as well as we prepare you for the board examination. Our program is designed to have a lot of interaction and a lot of hands-on, as well as theory courses that could be taught online or in class. You will also interact with other professions in the college, like nurses or students from the nutrition and food service management in some group work and projects. You will also learn a software that's used in a lot of the pharmacies to enter prescriptions, so you are well prepared to go into the work field. Our labs are all maximum 14 students in a lab, so one faculty for 14 students or 12 students. Our faculty do a lot of discussions and are always available to um, help and support the students. Lectures could be face-to-face or sometimes online, as I said before. So it's different styles of teaching to meet all the needs of all the different learner styles. So as I said, our program is 2 years and divided into 4 semesters. We do not have summer classes, and we run fall and winter only. We have about 24 hours of class or lab time per week. You are required to devote about 10 to 15 hours of studying per week and homework and stuff like that. It is full-time basis, so everybody should schedule their work according to your timetable. And we run between 8:30 and 6:30. We don't have evenings or we don't have weekends. So again, discussing the number of hours per week, the only time you have 40 hours a week is in semester 4, where you do placement and you do 4 weeks of placement in community setting and 4 weeks in hospital setting, and it is based on 40 hours per week, Monday to Friday. It is unpaid practicum. Um, and it is a requirement by our accrediting body, and it involves a lot of your attention, and it is full-time, but it is the best experience you will have, and it is crucial um, part of our program. But it is a plus because lots of our students get hired at placement. Before they exit the program, they usually get contracts and they get hired full-time. So it's a great experience. Discussing placement requirements, you will have a lot of sessions to inform you more about the placement requirements, but some of it you might want to know. You will have to do some vaccination, you'll need to do a police check, you will need to do a mask fit-in. So when you go to the hospital, you will require to wear a mask. And these requirements will all be discussed with you when you start school in semester 1 as well as semester 3, and we make sure that you are aware of the deadlines, so you are prepared to go on placement, because there is also 40 hours of placement that has to be done in semester 2. That is on top of the 320 hours of placement in semester 4. So placement is a big part of our program, as I mentioned before. So I'm not sure if you have already made up your mind that this is the right profession for you, being a frontline healthcare provider, using your critical thinking to make decisions, able to be part of a team, because in a pharmacy we work as a team. We cannot work alone. We're always discussing and working together with the pharmacist, pharmacy assistants, doctors, nurses, etc. Um, you are focused on your task, and you are very detailed oriented. All these are some of the characteristics that are required for this profession. At Centennial College, you will always have the support of the college during your program. We do have a library and a resource center for you where you can get access to laptops, to books, to resources, online resources. You have access to computer labs to practice your software and prescriptions. You do have access to free tutoring, peer tutoring, where we hire pharmacy technicians and higher levels to come and tutor you in semester 1 and semester 2 and semester 3 as you go and progress through the program. We also have a center for academic and accessibility calcs, and that there we have counselors that are there to support you mentally and support your learning if you have any disabilities, learning disabilities. So there is a lot of resources that we can attach you, connect you with, and you can make sure you are succeeding and going through it, through the program very smoothly. So I'm not sure if you are aware, there has been a change in the scope of practice for pharmacists and pharmacy technicians the past few years, and due to this, there is a high need for pharmacy technicians in the field. We are short of pharmacy technicians, especially in hospitals. They are thriving to hire pharmacy technicians. So you're coming in this program at a good time. As a matter of fact, as I said before, they have been hiring our graduating students before they finish their placement and before they become registered. They're giving them contracts in a hospital. So it is a good time to join this program. Um, and also the pay, and I don't want to talk about the pay much because it varies from one institution to the other and from one pharmacy to the other, but the pay is good, and the profession is growing. And with this COVID-19 that's going on, pharmacists are looking for professionals that are trained and well prepared for the field. So it's a good time to start the program now. So the requirement for the program to apply, you need to apply through ontariocolleges.ca. There is a grade 12 English requirement, as well as chemistry is a requirement, biology or physics is a requirement. We have two intakes, one in the fall and one in the winter. In the fall usually is the bigger number of students, so we have about 80 students join the program, and in the winter semester we usually have about 60 students who join the semester. All students have to do an English assessment at entry level, and that will decide or determine which level of English you require, because we do have two English courses that you need to take. I would like now to take you on a virtual lab tour to see our labs and to have a look at what you will be working, what environment you will be working in. And I have to tell you, our labs have been renovated the last 5 years, and we have high quality equipments. We have all what you need in a learning environment. And even the University of Toronto, the School of Pharmacy, they do not have the same labs like us. And other colleges, they come and look at our labs to duplicate them. So we're proud to have these labs, and we like to showcase them. So if this wasn't a virtual session, I would have taken you in and would have given you the tour in person, but the pictures should do it a little bit of justice. So here is the first lab that you will be working in the first semester and the second semester. It is a dispensing lab. We have spots for 30 students, but we only occupy 14 students at a time. Each will have their own computer, their dispensing area, and it is also used for compounding, which is taught in semester 2. So in semester 1 you will be doing dispensing here. In semester 2 you will be doing compounding, dispensing, as well as a math course that we teach in this lab. Again, this is a different view of the same lab that you will be using for dispensing, as well as for compounding. Notice that you have the scales in the middle, the digital scales. We also do have more scales, but they're put away so we don't have too much clutter. We have different types of scales that you will learn to use during the compounding lab time. So lots of hands-on. Notice the drug wall in the back that mimics the drug wall in a real community pharmacy. We do have real bottles of drugs. We have placebo tablets in all the drugs that look alike to the real drugs. We don't have any real drugs in our lab, only real bottles of drugs. And so that gives you a feel of you're really working with prescription drugs, and it's a great environment actually. The second lab I would like to show you is the aseptic lab, and this is the lab you will be working in semester 3 and 4, where you get to be introduced to the pharmacy environment in a hospital setting. In this lab, you will learn how to prepare medications that are prepared in a hospital pharmacy, some of which are pre-filled syringes, IV bags with drugs in them, of course, not real drugs, but like how you prepare an IV bag with a medication in it. Because in the hospital, the IV bags that you see the nurses hooking to the patient or attaching the patient to is really prepared by a pharmacy technician. It's not prepared by the nurse, and it's not bought ready-made. It has ingredients in it that are added by the pharmacy technician. So your job in the hospital is very crucial and very important. Notice the equipments that is on the wall. This is the laminar flow hood, very unique, expensive equipment that is used in the hospital, where you prepare the IV bag to make sure to make sure no dust or no microbes will get into the IV bag as you prepare it. It has a huge HEPA filter to make sure it filters the air. The techniques used here are immense, very delicate techniques and very unique, and we have excellent faculty that work in this lab, and you become expert in these techniques. So very proud to showcase this lab as well. The last lab I would like to show you is the hospital and long-term care lab, and this is also introduced to you in semester 3 and 4, where you learn how to pre-package the medications in unit doses so you can dispense them just like they are dispensed in the hospitals, as well as long-term care facilities have their drugs delivered from pharmacies that are specialized in packaging the medications for seniors and older people that are in nursing homes in a special way. So a lot to learn in this lab. Again, semester 3 and 4, and a huge demand for you to work in this field at this point. So as I said, the labs are top notch and they are great to work in, and a lot of learning happens with hands-on. Finally, I would like to share with you my contact information. This is again my email, and my phone number and extension is 8089. I would ask that you don't call me right now, but email me, because as you know, the college is closed right now, and we are working from home, so I respond to emails better. We check emails all the time, and I will respond faster by email. So make sure, please send me an email with any inquiry you have, and I would love to see you join our college in the fall, and would have loved to meet you in person, but we can always meet virtually, and I can create a room, and I will virtual room, and we can meet online, no problem. Thank you so much for taking the time and listening to my long presentation. It was a pleasure to give you all this information, and looking forward to hearing from you. Thank you. Take care.